welcome to my YouTube channel. Today we are going to learn about various routes of drug administration. This is the first and foremost topic of pharmacology, which is very important on university exams. So there are two types of routes of drug administration, local and systemic. We will discuss each thing in detail. Local routes of drug administration are given when we want a localized response, or we want a localized form of treatment in the body. So there are three types of local routes of drug administration: topical, deeper tissues, and arterial supply. In topical, the normal example is external application of the drug on the surface of the body or in any of the regions like vagina, mucosa, eyes, ear canal. So there are two examples for topical routes of drug administration: salbutamol and lidocaine. In deeper tissues, we can also give local routes by administering in deeper tissues of the body through syringe or needle. Examples are intra-articular, in between the joints; intrathecal, which means in between the nerves; or retrobulbar. The word directly means retrobulbar, means behind the eyes. Another route of drug administration is arterial supply. This is generally given when we have to administer drugs for cancer. Anti-cancer drugs are given by this method, and also we use this for contrast media in angiography. So we will also learn about systemic routes of drug administration. The systemic routes of drug administration are given when we need to treat various systems of our body. Example: respiratory system, cardiovascular system, or CNS, or any major systems of our body. The different routes for systemic drug administration are oral, sublingual, rectal, cutaneous, inhalation, nasal, parenteral. Let's learn each of this route of drug administration in detail. The first route of drug administration in systemic routes is oral. Oral routes are safer, convenient to administer, and they don't need any assistance. And it is generally non-invasive, and it's very painless form of drug administration. It's also cheaper than various other routes of drug administration. Whenever you read a topic of drug administration, we will read in these three subtopics: advantages, disadvantages, and examples. And it is better to write this way in university exams to score more marks. The disadvantages of oral routes of drug administration are: they are not suitable for emergency. If someone is having a heart attack, or they are in an emergency when they can't even respire properly, we can't give oral route of drug administration in that time, because they can't swallow it, and there is a long time for the drug to get absorbed and to get working on. So one more disadvantage is unpalatable and difficult to administer. It is generally unpalatable. Sometimes the taste is not good. Sometimes it's difficult to administer in uncooperative patients or in unconscious patients. Sometimes when the patient has nausea or vomiting, we still can't administer oral routes of drug administration. And absorption is variable. Each and every drug has different level of bioavailability. Means whenever it reaches up to the systemic circulation, it has to go through liver, in which there is first pass metabolism. First pass metabolism is something we have to study in detail. First pass metabolism, if I have to cover it in short, it is just when a drug is taken through the body, when it goes to GIT, mainly it is absorbed into the systemic circulation. But before that, it is passed through liver. In liver, liver is generally made in such a way that it filters out some toxic substances, also some substances that are foreign to our body. So this is also called as first pass metabolism. The other disadvantages are absorption is variable. Means once you take a drug, you don't know how much of it gets absorbed into the body. It cannot be used in uncooperative patients. And the examples are tablets and capsules. Oral route are tablets, capsules. In tablets you can write paracetamol, Dolo 650 or something like that. Let's discuss about sublingual route of drug administration. The advantages of sublingual method of route of drug administration is its rapid action. It can be given in emergencies. After the effect of the drug is obtained, it can be spitted out. Unlike oral route or any other route, the drug cannot be undone. In this sublingual route, it can be spit out after the effect is obtained. In this, liver is bypassed. The disadvantage of the sublingual route is only lipid soluble drugs are normally absorbed, and non-irritating drugs can be given. This is an advantage of this sublingual route of drug administration, that non-irritating drugs also can be given. It is somewhat inconvenient to keep it under the tongue. Example are glycerol trinitrate, buprenorphine, desamino-oxytocin. Let's discuss about the rectal route of drug administration. The advantages of rectal route of drug administration are: some irritant drugs can be put into rectum as suppositories, used in patients having recurrent vomiting and when the patients are unconscious. The disadvantages are: it is very inconvenient and embarrassing. Absorption is slow and variable, because there are two types of veins in the rectum: external hemorrhoidal veins and internal hemorrhoidal veins. The external hemorrhoidal veins, when the drug is absorbed into them, it bypasses the liver. But when the internal hemorrhoidal veins absorb the drug, it is generally passed through liver first. So the first pass metabolism is acting in internal hemorrhoidal veins. In external hemorrhoidal veins, the liver is bypassed. The examples of rectal route of drug administration is, we can give paracetamol or diazepam. Let's discuss about cutaneous route of drug administration. The advantages of cutaneous routes of drug administration are: liver is bypassed. It can be applied over skin. It is slow and prolonged absorption it has a slow and prolonged route absorption. The disadvantages are: it is only highly lipid soluble drugs can be given through this path. TTS, transdermal therapeutic system. When a drug is given as transdermal patches, the drug slowly diffuses into the skin and reaches the systemic circulation. Examples are GTN, nicotine, estradiol. TTS lasts for 1 to 3 days. Inhalation. When a drug is inhaled, we can generally see there is a rapid onset of action. Then the drug is rapidly eliminated by expiring the air outside. Controlled administration is possible. A set value of doses can be given. The disadvantage of this part is inhalation route is: irritant vapors cause inflammation of respiratory tract. The nasal route advantages are: Liver is bypassed. Digestive juices are bypassed. When it is given, when drug is given by oral route, generally it has to go through various digestive juices, then through liver, then it has to reach the systemic circulation where it gets absorbed by the organs. So in nasal route, generally the liver is bypassed, so and digestive juices is bypassed, so the absorption of the drug is increased. This route is now being tried to give peptide drugs like insulin, as it can bypass the blood-brain barrier. Examples of nasal route are GnRH agonists, calcitonin, desmopressin. Let's discuss the last route of drug administration called parenteral route of drug administration. Parenteral means beyond intestine. This route of drug administration totally bypasses the intestine or GIT. So there is higher bioavailability of the drug. Advantages are faster and surer. Vomiting, gastric irritation is not provoked in this route of drug administration. This can be administered in unconscious and uncooperative patients. In vomiting type of patients also it can be administered. Liver is bypassed. Disadvantages of this route. The needles or syringes that you take to administer the drug should be sterilized. It is comparatively costlier, painful and invasive type of process. Assistant is needed. Mostly there is need of assistance, but in some parts there is no need of assistance, as insulin can be taken by self. Subcutaneous route of drug administration. Parenteral route has 4 types of drug administration: subcutaneous, intramuscular, intravenous and intradermal. Subcutaneous route of drug administration, the drug is deposited in loose subcutaneous tissue which is supplied by nerves, but it is less vascular. It has less amount of blood vessels. The examples are dermojet, pellet implantation and biodegradable or cyelastic implants. Intramuscular. The drug is injected in one of the large skeletal muscles, deltoid, gluteus maximus. The muscle is supplied densely by both nerves and vessels. It is less painful, but it needs deep penetration. The next route is intravenous. Drug is injected as a bolus directly into the veins. Highly irritant drugs can be injected and the bioavailability of a drug is 100%. But the disadvantage of this route is it can cause air embolism. It is also the most risky route because heart and brain get exposed to the drug. Intradermal. BCG vaccine is generally given by this route. The drug is injected into the skin, raising a bleb. Means you should pierce the skin which means you should pierce the skin, pinch the skin a little bit to give the injection.